Hi, I am Allison Kaminski. I'm one of the health coaches here at Partner MD, and I'm going to be discussing aerobic exercises for your heart today. So we'll start off with CDC guidelines. CDC recommends about 150 minutes of moderate intensity exercise per week, aerobic activity per week. And if you break this down, it can look like 5 days of 30 minutes of aerobic exercise, 3 days of 50 minutes of aerobic exercise. They also say that you could get 75 minutes of vigorous intensity exercise per week, or a combination of moderate to vigorous. So why do aerobic exercises? Well, aerobic exercise has a multitude of benefits, such as lowering your blood pressure, reducing stress, strengthening your heart muscles, improved mood, decreased risk for depression or anxiety, or increased or decreased intensity of depression or anxiety symptoms, better sleep, improving balance and joint flexibility, and then of course it helps you maintain a healthy BMI and body fat percentage. So what are different types of aerobic exercises we could do? Obviously, we have the very traditional ones that I'm sure you can think of off the top of your head, like walking, running, cycling, swimming, lots of, prolonged activity. You can also do some sort of HIIT training, like high intensity interval training or circuit training, where your heart rate gets way up, you take rest breaks, it goes back down, way up, and you kind of do intervals like that. And then also sporting activities. So think soccer, tennis, pickleball, basketball, things like that. A combination of all of these is going to be the most beneficial because you're challenging your heart in multiple ways. So you're not just getting out and walking for 3 miles a day every day, and then sooner or later your heart's going to get used to it, and then you're not challenging it anymore. So if you mix some walking in with some interval training, some circuit training, even on your walks, if you pick up the pace for 5 minutes and then back off for 1 or 2 minutes and kind of repeat those intervals, that's a fun way to mix it up. And then doing some sort of sport where you're constantly engaged, you're mentally engaged, and you're challenging your body to do short sprints and then back off for a little bit, but you're constantly moving. Those are going to be very, very beneficial. So let us know if you have any questions. That was a really, really quick synopsis of why aerobic training can be beneficial, but it is great for your heart. I would highly recommend doing it. So, like I said, I'm Allison. I'm one of the health coaches here at Partner MD. Thank you for tuning in.